Guys, after going home with your brand newborn, you feel something's off. The aching in your lower belly is sharper than the normal after pains, and there's a fever creeping up. And the bleeding that you usually have after postpartum is starting to smell foul. So you listen to your concerned partner and you call an OB. It's a good thing you did because you later found out that you had a condition called postpartum endometritis. Postpartum endometritis is the infection of the outer laying of the uterus that can occur 24 to 72 hours after childbirth. We'll be talking about the foundations of this condition, the risk factors, the symptoms, and the diagnosis and treatments, and what your care team will do to try to avoid this condition. Let's talk about our risk factors. According to Getting Through the Times, an academic article about the type of infections that can occur after giving birth, you can likely get this infection if you had an emergency C-section, too many cervix checks, or having a prolonged labor. So basically, if you had any external factors going near your uterus area. Now that you know about the risk factors, let's talk about the symptoms. According to Mac Manuals, a postpartum care associates with disorders and common side effects after giving birth. This condition comes with a high fever and abdominal pain, and a discharge which can be found through an odd odor, or can have a which can be fishy or rotten, and your discharge will have a yellowish green color. And in some cases, you may have a rapid heartbeat. Due to this condition not exactly having a test for it, how we diagnose it is based off of symptoms and physical exams. We also have to be little detectives here and trying to figure out certain things. For example, if you have a fever, is it the fever caused by this condition, or is there a dozen other things? Is the fever caused by a UTI, or is it caused by an infected surgery wound when we did the C-cut? I mean the C-section, or is it just a blood clot? Most of the time, we'll have to do a physical exam, like a pelvic exam, and to do an assessment on the uterus tenderness, as just to check all of our factors. Once we figure it out that it is the uterus that is infected, we can treat for it. How we treat for this condition is very simple. We do 2 rounds of IV antibiotics to hopefully cover all of our bases. When we tried the antibiotics, we first want to see if the condition can improve after a round of antibiotics, 2 rounds. If you approve within 48 hours. If you do not, your care team will do a better assessment to see if you need a further evaluation or ultrasound to see if there's any other complications that may require surgery. Now, do you know your team's care plan? Let's talk about some preventions that your care team may take. According to Mark Manuals, a postpartum care that study shows that at least an hour of IV antibiotics before a C-section and an emergency C-section, the infection can go down for a regular C-section, 75%, and an emergency C-section down to 10%. Your care team may also practice sterile techniques during delivery and may try to limit cervix checks to prevent external bacteria entering the uterus. Now that you know about this condition, I hope that you have no fear in realizing that there's something wrong and that you're prepared and now know what your care team is willing to do for you. And before we leave, I just want to make sure that any other symptoms you do see, you know to go to your OB about. The CDC has a HER campaign where we talked about how they have a HER campaign where they talk about different postpartum pregnancy conditions or symptoms. If you see any of these symptoms in your partners or in yourself, we encourage you to go to your OB immediately. Thank you and have a great day.